Hi, I'm Dr. Brian Gillis, and I'm going to talk a little bit today about that new test that you've been seeing on TV called the cologuard test. And what I'm going to do is I'm just going to briefly kind of tell you what the indications for the cologuard test are for. Cologuard is intended for the qualitative detection of colorectal neoplasia-associated DNA markers and for the presence of occult hemoglobin in human stool. A positive result may indicate the presence of colorectal cancer or an advanced adenoma and should be followed by a diagnostic colonoscopy. Cologuard is indicated to screen adults of either sex, 50 years or older, and who are of average risk for colorectal cancer. Cologuard is not a replacement for diagnostic colonoscopy or surveillance colonoscopy in high-risk individuals. And who is it not for? Cologuard is intended for patients age 50 and older at average risk who are typical candidates for colorectal screening. Cologuard was not clinically evaluated for the following types of patients: patients with a history of cancer, adenomas, or other related cancers, patient who had a positive result from another colorectal cancer screening method within the last 6 months, patients who had been diagnosed with a condition associated with a high risk for colorectal cancer, inflammatory bowel disease, ulcerative colitis, Crohn's disease, family adenomatous polyposis, family history colorectal cancer, patients that have been diagnosed with a relevant familial hereditary cancer syndrome, such as hereditary non-polyposis colorectal cancer syndrome, Lynch syndrome, Peutz-Jeghers syndrome, MYH associated polyposis, Gardner syndrome, Turcotte's or Crayle's syndrome, Cowden syndrome, juvenile polyposis, Cronkite Candida syndrome, neurofibromatosis, or familial hyperplastic polyposis. So that's all pretty medical, so I'm going to break it down for you. What Cologuard is really for is for the patients that are of average risk, meaning that if you're 50 years old and nobody in your family has any one of those very rare diseases or inflammatory diseases, and you do not have a personal history of any of those things, and your history is relatively negative to everything associated with colorectal cancer, it's a really good screening test. And what I'm advising my patients to do is that we go back and we look over our file, and if we have somebody that is at no risk, instead of doing a colonoscopy, we have them do the Cologuard test. The Cologuard test is really good if it tests negative, meaning if you get a Cologuard test and it tests negative, that it has a very high specificity for being accurate in the sense that you don't have colon cancer. One of the drawbacks of the Cologuard test is that it has a very high false positive rate. Now this is where it gets confusing. So if you take the test and it's negative, you can be rest assured that you don't have colon cancer. If you take the test and it's positive, it's really actually pretty unlikely that you have cancer in my experience so far, but you probably have a polyp. So people that test positive with the Cologuard test, don't get excited. We check your colon with a colonoscopy, and the majority of the time the test was positively false, meaning that there was nothing wrong with you or that you just had a polyp, which a polyp is a cancer, but if you don't get rid of it, it can turn into cancer. So those are the indications that I use for the Cologuard test. I particularly like it also for patients that might be at high risk with other comorbidities, but have no risk for colon cancer. Because a colonoscopy is a relatively serious procedure. You have to receive IV sedation that can cause respiratory depression, increase your cardiac output. The colonoscopy has a bowel prep that can influence your electrolytes and your kidney function. So for me, I think that this test is really a great alternative to be assured that if it is negative, that you don't have colon cancer. So in our office, we've been utilizing the Cologuard test for almost 2 years, and we're using it more and more and more. And I endorse it, and it's a safe alternative to a screening colonoscopy. I'm Dr. Brian Gillis, informing you of the new Cologuard test. Have a good day.